So this is the algorithm that was created to help you understand if your patient is ready to adjust their insulin on their own. And this would be what you would ask them is, do you understand what you have been asked to do with adjusting your insulin? So you would go over the checklist for the self-adjustment of insulin with them, and what does it mean to self-adjust my insulin? If the patient, when they answer the checklist, if they're checking off mostly fair or needs work when they're answering it themselves, then you would consider that a no in the readiness assessment, and you would need to clarify their learning needs, review, educate as needed, and that's when you would initiate the readiness assessment when they feel that they are ready and know what they are doing with adjusting their insulin themselves. So once you're comfortable with them completing the checklist and most of their answers are very good, then that would be yes, they are ready to move on, and that's when you would complete the readiness assessment. So they are yes, ready to move on, or no, they aren't ready. If they aren't ready, then you need to ask perhaps why, or sort out reasons why they aren't ready. Is there some psychological insulin resistance? And you can do the questions and answers and look at the video. Is there an underlying fear of hypoglycemia? Is it motivation or comprehension and cognition? So then from that, the action for this would be to inform the provider, their provider. Perhaps they need family home care VON support, and maybe the family doctor needs to do the insulin adjustment on their own. Some diabetes centers may be able to provide time-limited supports, but not ongoing forever. Is there a preparation and reassessment process for this patient after perhaps VON has been involved with them? Are they going to be capable of learning how to adjust their insulin on their own? If the answer is yes, then you need to develop the action plan, provide tools and supports for adjusting the insulin, and we have created handouts to help you with that, instructions on how to adjust your insulin. Part 1, starting on insulin with one insulin injection only. Part 2 would be when the mealtime insulin is added to that. Then Part 3 would be when it's MDI with both basal and bolus insulin. If they are not ready and they are not able to complete the checklist easily, you may need to perform a cognitive assessment to evaluate all levels of comprehension, or once again notify the referring provider to let them know that their patient will not be able to adjust insulin on their own at this time. Other video support series will be the benefits of self-adjustment, fear of hypoglycemia, psychological insulin resistance, and how to adjust your insulin. Supporting questionnaires that exist are the management of fear of hypoglycemia, the Montreal Cognitive Assessment, and the psychological insulin resistance questions. If your client is ambivalent, then you want to discuss the checklist and the pros and cons of self-adjustment of insulin. Also discuss with them psychological insulin resistance statements, which are listed below, asking them about the way that they feel, and also assessing to see if there is a fear of hypoglycemia. Hope that you find this helpful, and there will be supporting videos and questions to come along with the psychological insulin resistance, fear of hypoglycemia, comprehension, and cognition.